Introduction of respiratory system. The respiratory system helps us breathe. It brings oxygen into the body and removes carbon dioxide. The main parts are the nose, one part trachea, and lungs. Air goes in through the nose or mouth, travels to the lungs, and the body takes in oxygen while getting rid of carbon dioxide. So in here we have three definitions, which is the first one is the exercise-induced asthma, EIA, a condition where physical activity triggers airway narrowing, causing symptoms like shortness of breath, wheezing, and coughing. It occurs due to increased airflow demand and inflammation or hypersensitivity in the airways. Next, we have respiratory muscle fatigue, that it is weakening of the muscles involved in breathing, example, diaphragm and intercostal muscles, after prolonged or intense activity. It can reduce performance and lead to inefficient breathing, especially during high-intensity exercise. And lastly is the altitude training adaptations. Training at high altitudes lower oxygen levels that stimulates physiological changes such as increased red blood cell production, enhanced oxygen carrying capacity, and improve efficiency of oxygen delivery to muscles. These adaptations can boost endurance at sea level.
So for the exercise-induced asthma, the adaptive responses is quite limited because of the maladaptive responses. Here I put two of them. One of them is airway hyperresponsiveness, AHR, where it is a heightened sensitivity of the airways to trigger like cold air, pollutants, or dehydration. This leads to exaggerated bronchial constriction. And the other one, chronic airway inflammation. It is a persistent, low-grade inflammation in the airways. It is due to repeated exposure to exercise-induced triggers for the athletes. And it leads to airway remodeling over time. And then, for the adaptive responses, here I put enhanced warm-up effects. For the pre-exercise or warm-ups, it can improve airway dilation and reduce the severity of exercise-induced asthma episode through better thermoregulations and preparation of the airway. And then next, enhanced recovery mechanism. So athletes with exercise-induced asthma, they may develop faster recovery from airway narrowing. It is due to increased parasympathetic regulation and quicker adaptation of the airway muscles.
Okay, so how does the respiratory system adapt in athletes' body during respiratory muscle fatigue? So the first one is they have increasement of ventilation efficiency. So what's that mean? So that means tidal volume and respiratory rate rise to meet oxygen demands. So that actually means the production of carbon dioxide will also increase through their cell actually, which they indirectly help to deliver more oxygen to the other muscle, and actually they also function to remove carbon dioxide more effectively from muscle cells in their body. So since athletes exhibit higher ventilatory threshold that allowing sustained ventilation at high intensities, so of course this allowing them to breathe less heavily during their training. Meanwhile, their body still meeting their body's oxygen needed. And then the next one is strengthen respiratory muscle. Okay, so every regular training like running, jumping and so on, of course all these activities automatically help to improve the strength of respiratory muscle. So those training might increase mitochondrial density in muscle that is actually function as to delay muscle fatigue. And in addition, accessory muscle compensate during respiratory muscle fatigue to maintain ventilation. So it means those accessory muscle like sternocleidomastoid muscle actually help our body with maintaining breathing even though when primary muscle are fatigued. So with this existence of accessory muscle, so of course this allowing their body to continue getting enough of oxygen for their muscle cell, and even it actually can avoid them from shortness of breath. And then the last one is activation of fatigue resistant muscle fibers. So actually the diaphragm are highly fatigue resistant in athlete's body. And so how it works? So the diaphragm will use more slow twitch fibers during intense exercise or fatigue. So that means these fibers actually better at working for long periods since they are designed for endurance that allowing them to maintain steady ventilation even when our body in fatigue state. So they, of course, have increasement of blood flow to respiratory muscle but might reduce the blood flow to other working muscle. So that means it will be focused to primary muscle first.
And let's move on to the last part. The last part, which is altitude training adaptation. So during exercise, the gas exchange requirement of the lung increases due to oxygen consumption and increased carbon dioxide production, and the both respiratory rate and tidal volume increases. Hence, alveolar ventilation also increases, and this causes the rate of gas exchange and minute volume.
Okay, for exercise-induced asthma part, so the way to optimize respiratory function to improve their performance is by doing pre-exercise preparation. For example, like breathing exercise, warm-up exercise, and then we have adjusted exercise type and environment. So I think before they starting the intense activities, of course, it is more preferable for them to begin with low-intensity activities first. For example, like yoga. So this help to promote breathing control and flexibility to athletes without stressing their lungs actually. And then the last but not least is optimize airway function. So the athletes of course need to maintain their proper hydration to keep their airways moist, which allowing them for smoother airflow and better breathing. So therefore, they actually really recommend to perform airway clearance technique, for example like control cogging and postural training age.
And the next one is respiratory muscle fatigue. So the first one is breathing techniques. There are two types of breathing techniques, which are first lip breathing to help to reduce air trapping, improve oxygenation, and decreases the work of breathing by keeping the airways open longer. And the second one is diaphragmatic breathing. It helps to encourage use of the diaphragm to strengthen the respiratory muscle and improve ventilation efficiency. The next one is respiratory muscle training. The first one is expiratory muscle training, IMT, using devices like threshold inspiratory muscle trainers to strengthen the diaphragm and intercostal muscles. And the next one is expiratory muscle training, EMT, focuses on strengthening muscles involved in expiration, beneficial for individuals with conditions like COPD. And the last one is exercise and physical therapy. The first one is pulmonary rehabilitation. It helps to structure exercise program focusing on aerobic fitness and strength training can enhance overall respiratory muscle endurance. And the second one is aerobic training, improves overall oxygen utilization and cardiorespiratory efficiency. And the last one is chest physiotherapy. It helps to mobilize secretions to improve lung mechanics in conditions like bronchitis or pneumonia.
Okay, so there are other strategies that can be discussed to optimize respiratory function for improved performance in scenarios is altitude training adaptation. So for the first one, we have altitude training. Train at higher altitudes to increase red blood cell production and oxygen efficiency. So next we have stay hydrated. Proper hydration supports lung function and oxygen transport. And for the last one is physical conditioning. It helps optimize respiratory function at high altitude by improving the body's efficiency in using oxygen.
In conclusion, the psychological adaptations of the respiratory system during exercise and physical activity plays a crucial role in enhancing athletic performance. Athletes demonstrate increased lung capacity, improved oxygen uptake efficiency, and enhanced respiratory muscle strength compared to non-athletes. These adaptations allow for greater oxygen delivery to the muscles, efficient removal of carbon dioxide, and better endurance during intense physical activity. Regular training introduces these changes, highlighting the respiratory system's plasticity in response to increased physical demands. Understanding these adaptations is essential for optimizing training programs and improving athletic performance.